Welcome to the International Herbal Medicine Centre, England. This episode is entitled, Blood Clot in Leg Treatment at Home. A blood clot, also known as a thrombus, is a gel-like mass that forms when blood changes from a liquid to a solid state. This natural process is essential for preventing excessive bleeding when you have an injury. The signs and symptoms of a blood clot can vary depending on the location and size of the clot. Common signs of a blood clot, such as deep vein thrombosis, DVT, in the leg or arm, may include swelling. One of the most common symptoms is swelling in the affected area. This swelling is often sudden and can be significant. Pain. Many people with a blood clot experience pain in the affected area. The pain is often described as a cramp or soreness. Redness. The skin over the clot may become red or discolored. Warmth. The area around the clot may feel warm to the touch. Tenderness. The affected area can be tender or painful when touched or pressed. Enlarged veins. Sometimes, the veins near the clot may appear larger or more prominent than usual. Please kindly subscribe to this channel. We need your help to keep this educational channel functional. However, problems can arise when blood clots form inside blood vessels when they shouldn't. There are two main types of blood clots. Thrombus. A thrombus is a blood clot that forms in a blood vessel and remains attached to the vessel wall. It can partially or completely block blood flow, leading to various health issues depending on where it occurs. Embolus. An embolus is a blood clot that breaks away from its original location and travels through the bloodstream. When an embolus reaches a smaller blood vessel and becomes lodged, it can block blood flow and cause complications such as pulmonary embolism, when it lodges in the lungs, or stroke, when it affects blood vessels in the brain. Stasis. Reduced blood flow, often due to immobility or sitting for extended periods. Hypercoagulability. Conditions that increase the tendency of the blood to clot, such as certain genetic disorders or certain medications. Endothelial injury. Damage to the inner lining of blood vessels, which can occur due to inflammation, surgery, or other factors. Blood clots can lead to serious medical conditions like deep vein thrombosis, DVT, which occurs in the legs, and pulmonary embolism, which can result when a DVT clot breaks free and travels to the lungs. It's important to recognize the symptoms of these conditions, such as pain, swelling, redness in the affected area, shortness of breath, and chest pain. A blood clot in the leg, known as deep vein thrombosis, DVT, can be dangerous and lead to various complications. The dangers associated with a blood clot in the leg include pulmonary embolism, PE. One of the most significant dangers of a blood clot in the leg is the risk of the clot breaking loose and traveling to the lungs, causing a pulmonary embolism. This can be life-threatening and result in sudden chest pain, difficulty breathing, rapid heart rate, and in severe cases, it can be fatal. Post-thrombotic syndrome, PTS. PTS is a long-term complication of DVT that occurs when the clot damages the veins in the leg. This can lead to chronic symptoms such as pain, swelling, and skin changes in the affected leg. These symptoms can persist for years and negatively impact a person's quality of life. Venous insufficiency. DVT can cause damage to the valves in the veins, leading to venous insufficiency. This condition results in poor blood circulation in the legs, causing symptoms like swelling, pain, and the development of varicose veins. Cellulitis. A blood clot can increase the risk of skin infections like cellulitis in the affected leg, which can be painful and require medical treatment. How to treat blood clot in leg at home. Follow your doctor's recommendations. The first and most critical step is to consult a healthcare professional. They will diagnose the clot, determine its severity, and provide you with specific treatment recommendations. Follow their advice closely. Take prescribed medications. If your doctor prescribes blood-thinning medications, anticoagulants, take them as directed. These medications help prevent the clot from getting larger and reduce the risk of new clots forming. Elevate the affected leg. Elevating your leg can help reduce swelling and improve blood circulation. Prop your leg up on pillows or cushions, keeping it elevated above heart level whenever possible. Compression stockings. Your doctor may recommend wearing compression stockings to help improve blood flow in your legs. Follow their instructions regarding the type and level of compression. Stay hydrated. Proper hydration helps prevent the blood from becoming too thick and promotes better circulation. Drink plenty of water unless your doctor advises otherwise. Move within your limits. Gentle movement, such as walking and ankle pumps, can help prevent blood clots from worsening. However, consult your doctor first to determine the appropriate level of activity for your specific condition. Avoid prolonged immobility. Try not to stay in one position for too long, especially sitting or standing for extended periods. If you have to sit for a long time, e.g., during travel, take breaks to move your legs and flex your calf muscles. Manage pain. Over-the-counter pain relievers like acetaminophen or medications prescribed by your doctor can help manage pain and discomfort associated with the clot. Avoid non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen unless specifically advised by your doctor, as they can increase the risk of bleeding. Monitor for warning signs. Be aware of any new or worsening symptoms, such as increased pain, swelling, redness, warmth, or changes in skin color in the affected leg. Contact your healthcare provider immediately if you notice any concerning changes. Diet and lifestyle. Maintain a healthy diet and lifestyle. Avoid smoking and limit alcohol consumption. Follow any dietary restrictions or recommendations provided by your healthcare provider. Remember that self-treatment of a blood clot should only be done in consultation with a healthcare professional. If you suspect you have a blood clot in your leg, seek medical attention promptly to ensure proper diagnosis and treatment. Blood clots can be life-threatening if not managed appropriately. Please can you kindly subscribe to this channel? We need your help to keep this educational channel functioning.